Okay, so we're going to pick back up with our disaster lecture and start with the bioterrorism agents. So, what I want you to know in this is that the nurse's role in the bioterrorism disaster preparedness. So, the nurse's role, we need to recognize the types of biological agents, their effects, and then the general response principles. So, our definition of bioterrorism is the intentional release of bacteria, viruses, or toxins to cause illness, panic, and societal disruption. So, our bacterial bioterrorism agent, a couple of examples would be anthrax and the plague. Um, but key points I want you to know is that our bacterial agents are going to cause rapid sepsis and respiratory distress. Um, these are going to be often treatable with antibiotics if recognized early. With our viral agents, I want you to know the example of smallpox. So there's no broad antiviral cure or care for viral bioterrorism is going to be supportive. We want to contain the virus, so isolating the patient, wearing the correct PPE, that's critical. And for some of these viral agents, we do have vaccination available. For our toxins, an example that I want you to know is the botulism toxin. Um, Knowing that it's our most potent toxin, and it can cause flaccid paralysis, so that would lead to respiratory failure. Okay, so with toxins, we want to act quickly after exposure. There is no person to person transmission of this. Okay, it's largely our treatment is going to be supportive, but there are some antitoxins that do exist. Um, so moving on to our, let me find my thing. Okay, so moving on to anthrax. So this is going to be a bacterial disease. Um, it's caused by Bacillus anthracis. So you don't need to know that, just know that it does come from a spore-forming bacterium. We have three ways that we can get this. First one's going to be inhalation. This is going to be our most lethal form. It's going to cause flu-like symptoms that progress to severe respiratory failure. Okay, cutaneous. This is going to be our most common but least deadly form. Entry is going to come through a break in the skin. So beginning as just a painless like vesicle, and then we have the black eschar that's going to come with the surrounding edema. But if untreated, it can spread systemically. And then our gastrointestinal anthrax, this is going to occur after eating contaminated meat. So this will lead to severe abdominal pain, nausea, vomiting, bloody diarrhea, which can lead to sepsis if untreated. Okay, so there is no isolation needed for this because it's not spread person to person. We want to use standard precautions as healthcare workers. There may need to be some decontamination necessary for environmental exposures, so like contaminated powders. Prognosis wise, it can be fatal if it is not caught early, especially if it's inhalation. So, early recognition and treatment are key for survival. For our antibiotics that we would use, usually ciprofloxacin, and doxycycline are going to be our first line, okay? So, in summary, what I want you to know is anthrax is a serious bacterial infection that can appear through inhalation, cutaneous, or gastrointestinal forms. We want to use standard precautions as a nurse because it is not spread person to person, but it will be fatal if untreated, and we need prompt antibacterial or antibiotic treatment. Okay? I feel like I skipped one. No. Okay. Next is going to be botulism caused by Clostridium botulinum. Okay. So this is going to be one of our most potent biological toxins. Okay. it is going to be a potent neurotoxin that can cause paralysis. So with that, we want to worry about respiratory failure. It is not contagious, so there's no person-to-person spread. It can be, we can get this several types of ways. It can be foodborne, so it can be from like improperly canned foods. It can be from wounds, so spores contaminate a wound. Infants can get it. That's why we don't give honey to infants. And then, what is it? Inhalation as well. So with this, our symptoms that we're going to see is, oh, that's my next slide. Okay. Alrighty, so signs and symptoms. A classical presentation of botulism, your patient will be afebrile, but you'll have symmetrical descending flaccid paralysis, okay, and then clear mentation. So key clinical features, so our red flags we're going to look for when it's early is going to be blurred vision, double vision, dysphagia, dysarthria, dry mouth, but this is going to be contrasting with like our Guillain-Barré where we're going feet up. This is going to be from head down, okay? They're going to have some hypotension, dry mucous membranes, urinary retention. So our key that we want here is diagnosis is critical, okay? So we want to recognize this early before we lead to respiratory failure, okay? Treatments for this are going to be, there's an antitoxin for it that's going to prevent the progression, but also supportive care monitoring your patient's airway, their gag reflex, cough, swallowing ability. So that a question could be kind of like the Guillain-Barré, like you notice that your patient is starting to have a weak cough. That's whenever we know that our patient's getting in trouble, okay? We can expect long ICU stays with this. Recovery can take up to months, okay? So our nursing priority is going to be airway and respiratory monitoring, okay? If we have any decline or any signs of decline, it would move to intubation. Frequent neuro checks. Alrighty, we want to be checking their vision, prepare for prolonged mechanical ventilation, administer an antitoxin promptly, and then any supporting nursing care, so maintaining hydration, nutrition, preventing pressure injuries, range of motion. You're going to kind of teach the patient family that they're going to be in for a long haul. This isn't a quick turnaround for this. Okay, standard precautions for this. We want to recognize again that it is not contagious, so it's not going to spread person to person. As a healthcare worker, we're going to do standard precautions. We do want to wash the person's exposed clothing, decontaminate the person if aerosol exposure was suspected. And then just clean our environmental surfaces with a bleach solution, okay? So with this, key nursing things, no patient isolation is necessary, okay? Let's move on to the plague. Alrighty, the plague is a bacterial disease caused by a bacteria that I'm not gonna attempt to pronounce, but you do not need to know the specific bacteria either. So this is often caused by rodents and transmitted by fleas. So we can spread by direct contact with an infected animal. Okay, or it can be a person to person via respiratory droplets. So this is going to be highly infectious and cause severe outbreaks. We are going to start treatment for this before we have lab confirmation. Antibiotics are going to be our first go-to. So first antibiotic you would start with is streptomycin. That's going to be our drug of choice. Second is going to be gentamicin. We can expect to treat this patient with antibiotics for about 10 to 14 days. Also with supportive care, so IV fluids, oxygen, vasopressors if needed, and then infection control. So we want to put this patient into droplet precautions until they've had 48 hours of antibiotic therapy. Okay. Alrighty, so key takeaways from this one. This is one that you are going to put in droplet precaution for at least 48 hours after antibiotic therapy. Antibiotics, you're going to use streptomycin, gentamicin first. Okay, signs and symptoms: a high fever, chills, headache, chest discomfort, dyspnea, cough, hemoptysis, GI symptoms, and rapidly progressive respiratory failure and sepsis 2 to 4 days after the onset. Treating with the antibiotics again, and that's going to be your streptomycin and gentamicin. Alrighty, next up you have the review questions. You have the answers for those after the slide, so I'm not going to go through those. Just move on to the burn lecture. If you have any questions, though, make sure that you reach out.